Well, trying not to be loud. Oh, good morning, everybody.
Good
Or
morning.
good afternoon.
Happy Thanksgiving, everyone.
Hi, Mandeep.
Hello, guys. Hello, ladies.
Yes, happy Thanksgiving, everyone, and happy National Dental Hygiene Month. That's pretty exciting. Yay for everybody.
Very exciting.
I know. Oh my gosh, hope the weather's really nice this weekend too. I missed the pumpkin patch going to the kids last weekend. It was beautiful last weekend. I'm like, hoping it could be nice again this weekend.
Yeah, it's going to be beautiful. You can consider barbecuing your turkey.
Oh,
yeah.
That's new.
Delicious. Done that before. Yeah.
Is it good? Like, do you prefer it that way? I've never done it.
Yeah, that's the best. And then the mess is outside and you smell the entire neighborhood. It's fantastic.
When you're the house everyone's jealous of.
Yeah, well, people go walking and they can get that beautiful smell, and then somebody else decides we should have a sign up list though, so that we can have it smell on Saturday and then Sunday and Monday, right? So yeah, that would be the ultimate.
I'm excited. Now I'm hungry.
I know, exactly. But what day are you doing that? So I can go for a little drive over by your place.
Yeah, really.
Like, oh, surprise, I'm in the neighborhood.
Yeah.
Do you guys usually host on Sundays or on the Monday? What do you guys usually do?
Monday.
Monday.
I'm Sunday. Oh, I'm Saturday, Sunday, so we can see both sides that way.
Nice.
Yeah,
But we are, for my family this year, we're going to a pumpkin patch in the morning with all the kids, so that way then they can do their thing. And we're actually doing tacos, so totally out of the realm, but the kids like the tacos and no arguments. So there we go. That's our Thanksgiving dinner.
I love that.
Whatever they'll eat.
Exactly.
Yeah, exactly.
Right. Yeah.
All right. Well, I think we're good. We're live on Facebook now, and we're all up and running here. So let me just give my traditional housekeeping, and then let's get started. So we're very excited to have everyone here today. Just before we start, we love interaction as always. So if you have any thoughts or questions throughout the program, if you want to use the chat or you can use the Q&A, I'll try to monitor both. And then with whatever time we have a big group coming because this is a very exciting topic, but with whatever time we have, we will take up those questions. There will be a recording. So if you are kind of in and out, if you have a patient or client to get to and you have to take off, the recording will be available. So just sit back and enjoy. I'm really excited about the topic today. So Kath, if you don't mind taking over and introducing, great.
Sure, thank you. And I just wanted to say that for those, we have a lot of people who are registered. So what we're going to do is whoever has registered on Zoom, they will get access to the recording and then access to the certificate. So expect to receive all that. Well, Monday's a holiday, but Tuesday at the latest. So you don't have to email or check in. We have you. If you've registered on Zoom, we have you, and then you'll get it by Tuesday at the latest. All right.
Perfect.
So, all right. We're very excited for today to have Dr. Mandeep Johal. She was born and raised in Toronto, graduated from Case Western University School of Dentistry in 2010. She runs a busy dental office in her hometown of Guelph. She is the first to open a tongue and lip tie center in Ontario. Her commitment to lifelong learning ensures that she is always abreast of current knowledge, technology, and techniques. Countless hours traveling for continuing education to learn from the best. She has completed 3 mini residencies in orthodontics. She is certified to perform laser surgery by the American Board of Laser Surgery. She is also a member of the International Consortium of Oral Ankylofrenula, that's a mouthful, professionals, and a member of the American Academy of Dental Sleep Medicine. In addition, as a AAPMD Airway Collab chapter president for Toronto, is building relationships with the community and collaborating with other longtime and emerging leaders in the field. This has allowed her to build a collaborative approach on how she treats her patients. She feels very privileged to be a part of the well.ca family as their online dentist. She feels fortunate to go to work happy every day, knowing she is changing people's lives for the better. They can breathe better, eat better, better, speak better, sleep better, and feel their best. And I know we have had Mandeep on as a presenter with us, and we just get the best reviews about you, Mandeep. So thank you so much for being on with us today. And I'd like to just get this started by asking you how you started on this journey.
Yeah, that's a question. Thank you so much for the intro. That's a question I get asked, is what brought me along this path? What made me want to learn about this? It's my children. It's my son. So I started when he was 3 years old and cute as a button, but he had crowded teeth. And like every child with primary teeth should have gaps between their teeth. And let me tell you, it's getting harder and harder to find that image online of primary teeth with gaps between their teeth. So I just asked a simple question to my colleagues. I was like, hey guys, he has crowded teeth. Is there anything that we can do something about it now when he's little, so he's not in braces for like 5 years, or we had to pull out teeth? Because if he has crowding at the age of 3, he's not going to outgrow that crowding. And the answer was, I got responses like, don't be ridiculous. You're not gonna put braces on a 3-year-old. There's nothing we can do. He's too young. Wait till he's 13. I don't know why that's a magic number, but apparently 13, because a lot of orthodontists want to wait. Majority of them want to wait, not everyone. Majority of them want to wait till all the adult teeth come in. And by that time, what's happened is all we're doing is we're focusing on straightening teeth, but we're not focusing on the face and the bone that the teeth sit in. So it just didn't resonate with me to wait that long, because dentist mom, I was like, I'm not pulling my child's teeth out, because my husband and my son are carbon copy each other. Like they're identical. And my mother-in-law told me, she goes, Mandeep, she goes, you can do it anything you want. Like he looks just like his dad. And I'm like, I'm not trying to change that. I married the man for a reason. All I want to do is make sure that he's not in braces for a long time. She's like, well, my husband had to get all his baby teeth removed because the adult teeth were coming at the back. We've seen that, right? Like the shark teeth, we call it the shark teeth, when the adult teeth on the lower erupt lingually to the baby teeth. And then these parents come in, they're like, oh, these baby teeth aren't coming out. Can you help me pull them out? That was my husband. He had to get his baby teeth removed because the adult teeth weren't exfoliating the primary teeth. I said, that's not going to be me. I'm not going to do that to my son. And then that's what started my journey, when I started investigating and looking into preventative, like what can we do now? And then that's when I got into early expansion for kids, growing the face forward. But then the question still lingered, why? Why did this happen to my son? What made him had crowded teeth? And that's when I realized we started looking at tongue ties, started looking at his breathing. And I felt like an awful mom when my mentor asked me, Mandeep, how does your son sleep? I'm like, I shut the door, I go to bed, I put my other one to bed, and then I wake up in the morning and open the door, and he's amazing. He wakes up, everything is wonderful. He's like, no, he goes, I need you to actually watch your son sleep. I'm like, okay, I know that sounds awful, but we're busy. So I did it. I found that my son was snoring, tossing and turning. He wasn't getting the best quality of sleep he should be. He actually paused breathing. And the key to watching your children isn't just like once a week. You got to go periodically, because they have what's called catch-up sleep. And our sleep changes. Their sleep is going to change night per night, right? And that's when I noticed my son was snoring, wasn't breathing. He probably had early signs of sleep apnea, probably had sleep apnea. And then he had large tonsils, large adenoids. I mean, I don't understand. I went to the pediatrician, everything was fine. He was growing good. He was doing great in school. But then I started looking into breathing. I'm like, oh my God. And he's asthmatic. So that's why this is very near and dear to me about mouth breathing, because a lot asthmatic patients are all mouth breathers. Asthmatic patients are the ones that get upper respiratory infections. So this was just really close to me. He was the one that would always just get sick, and we just chalk it up to, oh, it's just germs in preschool. It's okay, all kids get sick. But he would be out longer, right? Sorry, I went a little bit longer, but just one thing leads to another.
No, it's really fascinating. And I think, having kids, having people that have kids, having nieces, nephews, all the rest, you really have to watch it. And it's really interesting because TikTok has hit it with mouth taping. Like, I feel like people are aware of this. So where can people learn more about mouth taping and the benefits? And actually, where can we go to get the right information? Because there's a lot of wrong information out there.
I know. I would just say do it under supervision, right? So it's like, I mean, talk to like an airway dentist. So I'm a general dentist, but like I specialize in airway dentistry. And I should clarify that some people think airway dentistry is airway management or sleep dentistry, and it's not. Airway dentistry is literally helping people sleep better, breathe better, and develop their faces. So you want to look for a provider that has training in that, or a myofunctional therapist that has training in breathing as well. Like, this is why I love working with you guys, because my hygienists, you guys are the most receptive to this and see the changes and are really into prevention. So I would say working with maybe a myofunctional therapist, airway dentist, and doing it the right way, because you want to make sure that the child can actually breathe through the nose. You know, what about if there's congestion, and how do we deal with that? Like, we want to address all those things. It's very simple, very, very simple. One thing that people don't understand, and it's weird how the body's designed, is when we breathe through the mouth, we're breathing too much air. And when we end up breathing too much air, the brain's like, wait a minute, you're breathing way too much. This is too fast. You need to slow down your breathing. But the brain still thinks we're breathing through the nose. So what ends up doing, it actually starts producing mucus in the nasal cavity. So now you got congestion because your brain's almost telling you to slow down your breathing. Because when we breathe through the mouth, we're breathing in way too much air. We only need about maybe 8 to 12 liters of air, but mouth breathing, we breathe in too much air. So it's kind of like a catch-22. So patients are like, oh, I'm too congested to breathe through my nose. So we got to help them clear that nasal passage so they can breathe better through the nose, especially for kids, right? Like, I have nasal irrigation sheets from babies to children to adults.
Wow, so there's a huge impact then, is what we're learning from you, for mouth breathing to children and babies. Could you just expand on that a little bit more, what we would see and what they would
Yeah.
experience?
Well, let's talk a little bit more about, even that's 100% right, but what they may not see or experience. Like, when you see a baby, that was another thing. I just did a baby show where I was at a baby conference, and I was trying to find images of a baby sleeping with the mouth closed. Could not find an image. It took me forever to find an image of a baby with the mouth lips sealed. And you know, we don't think anything of it because they're babies. They don't have any symptoms. Like, what symptoms they're going to have? But what's happening inside the brain, that's what's actually more disturbing. And I hate saying this because I know my kids are mouth breathers. I was a mouth breather my whole life. So before I tell you guys what happens, I just want full disclosure. I was a mouth breather my whole life until I got into all this myself. I still turned out fine, but the effects that it had, you know, are kind of irreversible. So what ends up happening when you breathe through the mouth, you're actually decreasing the oxygenation in the brain. So think about what that means. You're decreasing the amount of oxygen your brain's getting just by doing mouth breathing. And when do babies and children develop the most? In the first year of their life, the brain develops so much, and you deprive the brain of oxygen. Not 100% deprivation. The numbers are like 8%, 10%, which are significant, but not brain damaging significant. So I was one of those babies, but then I look back and I'm like, oh man, you know, I could have been an astronaut. Like, what else could I have done with my life? So I was like, I'm pretty happy with my life, because my mom's like, what, you turned out fine. Why are you always complaining? I'm like, I wish you knew these things. But so it's to put things in perspective too. It's like, I don't want parents freaking out, you know, or us freaking out. Is like, oh my God, what do I do? I screwed up my child. God, there's so many things we're going to do in our lives besides that. So I try to put things in perspective for them as well. As like, now we can do stuff, right? Like let's start now. And I feel great now. I've been taping for how many years now? You know, over 6 years, 7 years, and my sleep's improved so much, my quality of sleep. So there is never too late, is what I want you guys to understand. So sorry, going back to your question, is you won't see the effects of it right away in the baby. You might see little signs like, my baby's congested all the time. Or, you know, they're waking up frequently. They're not getting good quality of sleep. Those are the little signs you see like in an infant. In a child, you're going to see, when I mean child, I'm talking about ages when they're not napping as much. So let's say maybe age 3 and up, we shouldn't have any restless sleep. We should have a child like literally just going to sleep, with minimum tossing and turning, no bedwetting. A one that's really surprising, which I didn't know, I just thought my kids were just really hot kids every night, sweating through their pajamas. I was like, I changed sleep sacks, I changed pajamas, we put air conditioning, put fans in the room. I'm like, why do my kids sweat through their pajamas? Like, what's wrong with them? But that has to do with heart rate variability changing at nighttime for them because their sleep isn't the highest quality, right? Because poor sleep affects your heart, affects your eyes, it affects the brain, right? So there's more to it. So then you're going to start looking for signs in children is what their sleep is like. So you got to go in and take a look. Is their mouth wide open? And those are the easy ones to catch. The hard ones to catch are the ones that are just seeping slight air. So they might be sleeping like this and their mouth is open like this, slightly. And parents like, well, they're not mouth breathers. It's because when you look at a mouth breather, the mouth breathing is like, that's the obvious one, right? I was like, no, that's not what we're looking for. So even seeping air through the mouth slightly is something that we want to look for.
So can I ask you a question? I can instantly, I'm thinking of my kids, I'm thinking of my patients, and I don't know what age taping might be an option. Like, I don't know, I know I'd have to attend another course of yours to definitely find out more about that, but at what age could it start? Like, would it be, at that sort of 5, 6, a little bit to try to practice that? Because I can tell you, going through ortho and understanding my mouth a bit more, I'm like, I now purposely keep my lips together, so I have to breathe through my nose. When I started learning more about sleep and oxygen and that many years ago, and I can tell you all of us on the panel here have been sitting like this. It's not that we're not enjoying it. We're making sure our lips are closed so we get all the oxygen in. Okay. So patient age-ish, what time or what age could taping maybe be an opportunity or an option?
Okay, so let's go over different types of taping. So definitely not taping a baby, because babies, what you want to do with babies is they're so gentle, so easy to mold. When their mouth is open slightly like this, you want to get your thumb underneath. This is for infant, okay? Underneath this part right here, and just push up. So what you're doing is you're actually pushing the tongue up on the roof of the mouth. So what's going to end up happening is when you do that, the tongue's going to go up and you're going to create a suction on the roof of the mouth for the infant. So then you're just going to push up, hold it until the lips form a seal. And the lips are going to form a seal because of negative pressure from the tongue being sucked in, right? So it's just a nice light seal. So that's for an infant. Then you get to the tricky age, 2 is challenging. Like a big 2-year-old, maybe we can see doing this. But again, I would want to make sure that if anybody's watching today, don't go tape your children unless they've been assessed. But I'll give you guys some tips. I don't have my kinesiology tape here with me. I was looking for it, but believe it or not, we're all out. What I usually do is I usually get, you guys have seen kinesiology tape, right? It's like a thick band like this. So let's just say we got like a thick band. Arts and crafts is very common in the house. So what we do is, let's just say we cut the kinesiology tape about this wide for them, okay, like a little square. And then what you want to do is you never want to tape your child's mouth shut completely across. We don't want to do that. That's not what we're trying to do. We're actually trying to activate the nerves around the lips, okay, always around them. And you're going to create a tape that's going to look like this. So now look, I can talk. I can open my mouth. I can yell out, mama, right? I say that to parents. I'm like, look, you don't have to worry, because that's the number one thing everybody worries about. It's like, oh my God, how is my child going to breathe if they need to take a deep breath or call out for me? So I would say I feel comfortable. Again, like I said, you have to get clearance and have somebody check, make sure we go through nasal irrigation, the nose is fully clean, and start maybe even doing this during the day. You can start with a young kid, a 2-year-old watching TV with this, if they want the iPad or whatever, just put this on during the day. Because what you're trying to do, why I love kinesiology tape is I have different type of kinesiology tape for myself that I sleep with. I buy this one, Spider mini strip. This is for sensitive skin. So, because I alternate, and what happens is it comes in long strips and I just cut off like a little piece like this. But what I want you guys to see, what I love about this is how stretchy it is. Do you see that? How much give it has?
Yeah.
So I'm lazy. I just go like this at nighttime. So, and I can reuse this, but this is what we want. So that stretchability, I like making it words. The fact that it's it's stretchy. What my kinesiology, my physical therapist friends have told me about this. It's so great for like, if you have an injury or sore spot, what it does, it actually creates blood flow in that area. It actually starts activating the cranial, like the nerves in that area. So it sends all these messages that we think is just tape. I'm talking about kinesiology tape, not 3M tape, right? And so that little micro movement is literally sending wiring to the child's brain or the adult's brain to say, hey, we need blood flow in this area. We want this to start activating and to seal, right? Because these are the muscles we're really working on to toning. The other tape we usually recommend is like 3M tape, right? So we have a whole bunch of these at our house in our clinic, and you can just tape right across or like a little piece this way. We just want to get that seal and breathing through the nose. But again, I don't do any of this unless we've checked the nose. Maybe we need to breathe right strip. Maybe we need nasal dilators. I have tons of those too. I alternate every night between those, between a nasal dilator versus a breathe right strip, because breathe right strips are A, costly, B, sometimes they hurt your nose, like the bridge of the nose for me. Or some don't stay on all night. So I alternate between a nasal dilator that sits inside. I know it sounds uncomfortable, but first time I put it on, I was like, it's a whole new world out here. Like I've never been able to breathe like this before. It's pretty amazing. So I hope that answered your question, Carrie.
So you address both, like you address the nasal breathing and use the tape at the same time kind of thing.
Well, I always tell little kids, I'm like, how's your nose? How many boogies do you have? Right. So kids are just like, why do you care? I'm at the dentist. Why is she looking at my nose? But I mean, if we don't look at the nose, I mean, what are we just doing by taping the mouth shut? Because we want the nose to be clear. Is there obstructions in it? Nobody has a perfect nose. We got deviated septums. We got all those issues, but that doesn't mean we can't breathe through the nose. We can breathe through the nose. We just got to guide our patients and help them with, unfortunately, something we have to use every night. If we're not perfect, we're not symmetrical, this is something we have to use every night. But going back to another thing that I usually do in my clinic, I do early orthodontics, is I'm trying to avoid them from doing all these things for life at nighttime, if we can start expanding and growing those bases, right? I mean, that's part of my course when I talk about it, is when I'm doing expansion, we just think we're expanding the maxilla, but the maxilla is the floor of the nasal cavity. So think about why people have deviated septums. Deviated septums are very common in patients that have high vaulted palates. So if we can help prevent that palate from going up and squishing everything behind our noses, then these kids are more likely to live a life without nasal dilators and breathe right strips and all that later on in life, and sleep apnea. Sleep app machines.
You're looking at me, aren't you?
I am.
Tonight I'm going to go without my CPAP.
Wow.
For the first time in a long time.
I was waiting because I wanted to hear all about this, but I'm doing the taping tonight, and I'm going to have my first night without my CPAP. I've been doing myofunctional therapy for almost a year. So my tongue has gotten strong, all my oropharyngeal, I could feel it. I've got I don't have anything on me right now, but I've got my balloon that I manage the air between the palate and the balloon. So
that's amazing. Have you been, like, are you mild, moderate? Like what type of?
I'm severe. So I'm a little bit nervous, but I'll try it tonight and see how it goes.
Okay, so it should be done under supervision, because if you're severe,
severe.
Most likely it's really challenging, because if you're severe, so when we look at sleep, you want to look at three things. You want to look at structure, function, and the third thing you want to always look at metabolism too. So a lot of patients, when I talk about metabolism with our patients, I'm talking about your gut health. So what are the minerals like in your gut? Are you at your optimal level? I mean, not the Canadian medical level of vitamin D3, but your naturopath level of vitamin D3. You want to make sure that your iron, magnesium, zinc, all of them are where they're supposed to be at optimal levels so that your gut health is working at full steam, because we're not meant to be on supplementations for the rest of our lives. Our body is a well-oiled machine that can do a lot on its own once we give what it needs, because it's been taken away because of stress or structural issues or whatever it may be. But you want to address that too. And then structure. We want to make sure structurally the airways are big enough as well, so you're not getting airway collapse. So just monitor it very closely. Not recommending it. Just be careful. Just how do you monitor it though? Do you have like a monitoring system at nighttime for your sleep?
I do. Yeah, I do. I have something that monitors me, but now I'm not sure. We'll see.
Well, just monitor yourself and try it. Like, it's like if you were to live with sleep apnea for your whole life without not actually getting any intervention, then yes, that's not right. But one night it'll be okay. But just to monitor yourself so you know what your levels are like what are your O2, what's your O2 saturation like?
Yeah, I have all that.
Yeah, and what's your heart rate variability like, for sure. So monitor those things, and then you know that you're on the right track, or at least you've gone from severe to maybe moderate to mild. That'd be amazing.
Yes, it would be.
So anyways, I'm excited.
Thank
Keep
you.
us updated.
See, as I'm sitting here too, I have
sure.
my tongue at the roof of my mouth. There's all these things that I've learned, and I think Doris is on today too. But yeah, it's pretty interesting, the things that you don't really pay attention to until you're going through it yourself, and it's like, oh, where is my tongue all day? Am I breathing through my nose in and out? So it's been very helpful.
That's amazing. And then that's like what part of my course I'm doing with you guys, to show that the tongue, yes, helps with breathing, but helps us so much posturally. I hope to add on new testimonials from patients that explain in detail, like their findings from getting the release done is like, oh my God, like my knee doesn't hurt. Like the tongue is here, the knee's down there. Like, how does your knee not hurt anymore? How is that impact so powerful? You know, I just had a husband and wife that are both osteopaths from Thunder Bay, came in to see me for a tongue tie release for their baby. And they said they can't even work in their baby's mouth unless they work on his pelvis and hips for the baby. And these are because you learn so much. Like I love learning from osteos and chiros and naturopaths. Like it's amazing, like how they see the world and see us, right, as a whole. And they're like, Mandeep, you can't work like on our child's, like, or they can't work on their child's intraoral stuff unless they worked on his hips and loosened them up and put him in a certain position. And then the dad said, I'm able to get into my baby's mouth and release tension, because the tension was so tense without moving the pelvis and the hip. So anyways, well, I digress. I know this is about breathing.
No, it's good. I have two questions for you.
Yeah.
There were some questions coming in about where they actually get when you were talking about the nasal dilators. Where would they get something like that?
I'm just going to quickly grab it. Give me 1 second.
Okay.
Sorry, guys.
Sure.
This is such a fascinating show. And yes, I'm sitting up straight. I'm like, hey, everyone check your posture. I'm like, where's my tongue positioning? I'm like, it's supposed to be up, it's supposed to be down. My tongue's like flipping around in my mouth as I'm trying to keep my lips closed and breathe through my nose carefully. I'm like, okay, my children are going to have me like, it's hot, guys. Okay, guys, go to sleep. Let me see.
So creepy, right?
Okay, Carrie's coming out tonight at my house. I'm so sorry, children. I apologize. Okay.
I love these. My office is in my room, my bedroom. So I use these called mute dilators. This is a small size, but usually you can get these off Amazon. Sorry, but the way I open packaging, I open everything like a raccoon. My husband's words. Terrible. I open, but what you can do is you can get a trial size. So this is small. You can just get a trial size. So it comes in different sizes. But I love this because I mean, it looks super weird, but it's just so easy to use. So it literally just goes in here and it just like kind of sits on the little, oh, I could just do it right now.
Just do it.
I'm not gonna just do it right now.
We're all friends here.
Oh my gosh, feels so good.
Oh.
Like
Wow. So you just put
It's
that
so
on at
tiny.
night? Like, do you wear that during the day at all or just at night?
So during the pandemic, when we were wearing double masks, don't know why. I don't know why I always got a runny nose for some reason, because I think going back to all this, I was just maybe breathing so heavily through my mouth. I needed something. So I'd either have a breathe right strip or I had this underneath my mask. But yeah, you can wear this during the day. I mean, I wear this, I mean, I don't work out that much, but if I do, I'll have this on underneath well, we have tape on our treadmill and a nasal dilator. So that's how we usually work out. But yeah, it's
I love
pretty,
it. You know, you've had a
and
big
it's
influence on
reusable.
my family.
Sorry, what was
I was
that?
going to say, you've had a big influence on my family because I was lucky enough to be on one of your courses. I guess it's going back about a year. So my husband got right into all of this kind of the taping. And one night I snuck into my daughter's room to do what you said, like watch her breathing. And she woke up. She was like, "What are you doing?" She's like, "I love you." But anyways, everyone in my family is all on board with this. But I do have a question, and that is, whenever I hear you say mouth breather, it like triggers something in me, and I'm trying to figure out where that's coming from. And it's because there's been like TV shows, Stranger Things is an example, but it's been used as like a, am I wrong here? It's been used as like an insult. Is that the thing, right?
I know you got to be really careful. So I was going to tell you guys, just be very careful when we're talking to patients. We can't call their children mouth breathers, because I got called out on it, but in a funny way. I had a really funny family, and I was telling dad, I'm like, you know, your daughter is a mouth breather. Like, she has forward head posture, she's anxiety, she's all these things. And they started cracking up. I'm like, what's so funny?
Right.
Dr. Johal, have you ever Googled mouth breather? I'm like, no, why would I Google mouth breathing or mouth breather? Like, I don't know. It's something we do. Like, it's a thing. I Googled it under the Urban Dictionary. It said stupid person. Literally. So then that show Stranger Things or Stranger.
Yes.
And that's actually used as a bad word. So when I don't watch it, like I had patients tell me about it, but apparently they use it as like, you know, telling somebody off, like, you're an idiot. Instead of saying you're an idiot, you're a mouth breather. But it goes back to like all the way, like, you know, that long adenoid face. Do you guys remember? Like, that's right. But way back, maybe not that way back, like early 1900s, like 1920, 1930s, what they used to do is any kid that had the long adenoid face, like meaning, you know, on the dark circles, they would literally take these kids and put them in a separate class because they were called the dumb kids. So that's where it all stemmed from. And all they were mouth breathers, large tonsils, loud adenoids. They just had bad sleep. Nobody addressed their sleep. They just labeled them as dumb kids and put them in another class. So that's where it all stemmed from. I know it blew my mind when I don't know.
I have to share one story.
Yeah.
This is sad. When I was in grade 11, Mr. McCabe's class, I was sitting in my class and he looked to me in front of the whole class. He said, "Kathleen, close your mouth. You look stupid." Yes. Yes. Just came back to me.
Oh my God, I'm so sorry.
Okay, but
I thought I was being sexy, you know, like.
Not right. Oh no, I'm so
That was
sorry.
You are very sexy. Yes, you are very sexy. We're okay with that, Kathleen. Okay, but
okay, but wait a minute. How do we, like, is it bad to say mouth breather then? Can you not say that as like a, like, what do we say then?
So I'm very careful about it, right? Like when I talk to patients about it, well, first of all, there's so much more awareness about it too right now. So I'm sure parents are going to be very like, no, my son doesn't sleep with the mouth wide open. No, they don't do this. So they're very defensive about it. So I just say they're seeping air through the mouth, right? So then what I try to do is I try to draw their attention to like how big this pipe is, the mouth, versus these tiny cute little nostrils that are so small. I go, so if the mouth even slightly open like this, they're more like the air, where is it going to want to go, in a small pipe or a big pipe, right? So I try very hard to avoid your child's a mouth breather because I mean, they are.
Because it raises, right? It elicits, like, I didn't really know where that response was coming, but as we were saying it, it was eliciting something in me. And yeah, I've heard it on many different, I feel like it was earlier 90s movies. I think it's because my daughter's watching all these, you know, the movies that I watched when I was not that young, But I think that's where I was hearing it, is these kind of movies from like the 90s, maybe early 2000s. I remember hearing that term,
And that's
not in a
where
good way.
a lot of the stuff happens. Like if you take a look at like villains, they have like those big long, even witches, they had like the long pointy noses, but they had the long face as well. Like it's just, it all depicts like evilness or stupidity. It's like with mouth breathing. So if you say these kind of things to a patient, you've got to be mindful that it is offensive. Is it a meta?
Sorry, can you repeat for me then maybe a better alternative or wording? Because I know you said something and in my head, I'm like, hey, what am I supposed to say? Can I say something like, I suspect your child's breathing through their mouth? Is like to have a conversation? Or
Yeah,
how do you suggest we have this conversation?
100%. So you can say, I'm suspecting that your child is maybe not using their nose as much as they should be. You're literally tippy-toeing around saying the word mouth breathing. So anything you could possibly do, just don't try to use that word with them, because it is a trigger. I mean, the more I learn about it, I see my 7-year-old, he just sits there like this sometimes. I'm like, oh my God, my son's a mouth breather. And my husband's like, that's a trigger word. Don't use that trigger word.
But again, it's just our opportunity to educate people. Like sometimes people just don't think about it. Like now I ask everybody, where does your tongue, like where's your tongue placed when you're resting? I'm asking my sisters and everybody. It's like, because like, I just never thought about it before. Right. And then just letting people know that you really should breathe through your nose, not through your mouth. Like it's okay to share that information, and it might get people to think about, oh, I'm going to close my mouth,
Yeah. Oh, yeah. I'm not saying we shouldn't talk to them at all. You're 100% right.
Yeah.
Like, I'm just saying, try to find a different way around it is all I'm trying to say. Is like, but you bring up a good point. If your tongue is not on the roof of the mouth, you're mouth breathing, because your tongue is sitting low. I'm not saying you're tongue tied, your tongue sits low. You could be, but it's tongue position. If your tongue is sitting low, you're more likely to sleep air through the mouth, because you don't have that negative pressure seal to breathe through the nose, right? Like we have triggers that help us breathe through the nose, but we're not doing it if our mouth is wide open, or sorry, not wide open, just even slightly open, but our tongue is positioned low. You're more likely to breathe.
So interesting.
Wow.
I'm seeing some of the comments are coming through. Sorry. Some of them are going so fast, I can't see them.
Do you mind if I ask you a couple of them? Could we take a little? So someone was just, when you were talking about using the nasal dilator, just wondering, did you mean only during workouts, or during sleep someone can use that?
Oh my gosh, sleep for sure. I'm just saying you can use it for working out, because some people find it's weird for working out. But definitely for sleep, and please use it for working out. It's great for running, just great even going to the gym, because even for lifting heavy weights, I don't, but if you see people, they're like kind of clench your teeth and they're taking deep breaths, just breathe through the nose, so much easier.
I wonder if we wore a nasal dilator under an N95, if we would stop readjusting our mandible, like to change position, because I mean, we all catch each other doing it. And then first, especially if you've been off for a couple of days and you go back and you're like, moving things around, and so that might be really worth a try to reduce that.
I tend to have this, like, I'm working and I'm holding my breath, and all of a sudden I'm like, I'm like, no, sorry, I didn't mean to hold my breath. And I'm like, maybe I need to open my nose. I'm like, hey guys, I'm really sorry. This is the N95. I don't know why I have this habit, but I just can't breathe in as easily. So maybe I do need to look into that. There was a question as well, and I think Doris answered it, on usage of the nasal strip, not the nasal strips, the dilators. Like, is it a one and done, or can it be reused? And so Doris had mentioned or said that you could use it use it a few times, I guess.
Yeah, 3 months. So that's what they usually recommend for the mute, this brand, unlike this brand, but it still starts to irritate me because like my nose isn't perfect. I have a deviated septum as well, large turbinates on one side or the other. So like I said, I alternate between Breathe Right strips and the nasal dilator. But you guys are 100% right. Like I've had a couple of dentists that I've treated, and they didn't realize how much mouth breathing they were doing, because we do talk a lot, right? So I always say, try to make a very conscious effort. You're talking. Just really say, I got to breathe through my nose. Just do that if we have to do it, because now they feel less tired towards the end of the day, right? They feel less tired. So yeah, that's a great idea, guys. Oh my God, do you guys know women in hospitals have to, when they deliver babies, they have to wear a mask? So any pregnant woman, if you guys see them, please tell them to go get a breathe right strip for the hospital, because I don't know about you, but that'd be brutal if somebody told me I had to do that. But they do, they have to, and some nurses yell at them, unfortunately. So if you can, you guys come across any pregnant women, they're gonna have a baby at the hospital, please tell them to take some breathe right strips for them. It's really beneficial, because I've had so many moms come back to me and say that was the best. That was the first thing to tell all their friends, pack a breathe right strip for the labor.
Good advice.
Yeah, that's excellent. So, so about dentists and hygienists caring about their clients slash patients, breathing is super important. You've proven that to us. So, and we now have a better idea as to the impact. So just making them aware of lips together, teeth apart, and where is your tongue, and asking those types of leading conversations, very valuable. What types of impact, like positively, to your treatments have you seen with your patients?
By getting them to do mouth breathing. So for the way I do ortho in my clinic is all my ortho is done with a myofunctional therapy. So myofunctional therapy, it's in my clinic, and I think majority of the myofunctional therapists, if they're on here, includes breathing, right? So it's part of it. If we can get the tongue to do what it's supposed to do, get on the roof of the mouth, we can easily get the lips sealed, we can get them breathing through the nose. The impact's been that our treatment just goes so much faster and quicker. And we don't realize the impact breathing has, but it has a very good long-term from aesthetic point of view. Using the right muscles, like I always show patients this one. If your tongue is low, you see this right here. And if I lift my tongue up, you can see that it's like turkey neck, you know, you get older, we're getting the turkey neck. But over time, I was a severe class 2. Maybe I'll put that on my presentation that I'm gonna be doing with you guys next month. I'll show you guys, I didn't get surgery done. I was a severe class 2. And by doing myofunctional therapy, getting the tongue where it's supposed to be, and body work, we need body work, chiro, I'm kind of guilty of it, but it's been able to help me to bring that jaw forward. And I'm an adult, I'm 40s. So imagine doing this when you're like a child, a 3-year-old or a 4-year-old, the impact that you're going to have on dictating that face growth. So parents may not see it right away, but they will see changes in quality of maybe their kids' sleep. I mean, like you guys know, like anything, like when you do an ortho case, the more crowding there is, and then you get this beautiful smile after, like, yes, huge impact. Those are, I call the easy cases, because they're like, wow, that's great. Like these are impact, but it's the minor ones that we keep missing that we're not like, wow, that wasn't a huge change, but it changed the quality of that patient's life tenfold, right? And it's just patients may not have symptoms, but we treat enough adults to know that they're going to have symptoms later. And the hardest case I usually have to deal with is when I see 3 and 4-year-olds with severe class 2. I mean, they're in severe class 2 at the age of 2 and 3. You don't outgrow a class 2. So just think of it from an aesthetic point of view, how far back their chin is. But as you guys know, most our patients that have TMJ issues are class 2s. Majority of them were class 2s, or they've been camouflaged to look like they're not, but they're usually class 2 patients that have TMJ issues. So a 2-year-old isn't going to say, Mom, I have migraines, headache, I have TMJ. That's our future TMJ patient. That's our future migraine headache patient. But I've learned that through my adult patients, when I treat a lot of females that are like, I don't get migraines, Mandeep, anymore. I don't get headaches anymore. That's the impact that I get from the whole approach together with the mouth, with the nose breathing, tongue posture, and getting the jaw where it needs to be.
That's amazing, because you think of, you know, of my patient flow that suffer with migraines, you know, because I'm working in the dark with my headlamp on, because then that keeps them a bit more comfortable. But to offer them an opportunity to have that evaluation and find out if that type of therapy would alleviate or even lessen the amount of impact that those migraines have would be an amazing opportunity.
Well, the more you work with like osteos and chiros that really, or cranial sacral therapy, like they look at us and they're like, you guys are so lucky. They're like, you have the key, like you control so much for this patient and the impact they have. I'm like, how? People just think all we do is teeth. They're like, because it's the trigeminal nerve. If we mess up the bite for a patient, or their bite is off, they have a cross bite, we think nothing of it, or some people think nothing of it. It's just a cross bite, it's just aesthetics, not a big deal. It's the firing of the trigeminal nerves, and the trigeminal nerves show up when people have migraines, when fibromyalgia. Think about all those patients. We can help them by getting that bite where it should be, getting the tongue where it needs to be, and regulating their autonomic system by just getting the tongue on the roof and breathing through the nose. We do more than just teeth. Like we did a course about that too. I was like, we do more than just teeth, but it's so nice to hear it from my osteo colleagues in chiros. They're like, Mandeep, thank you so much. Now what we're doing, the adjustments are lasting longer, because guys, we breathe, we swallow 2,000 to 3,000 times a day. If you're swallowing incorrectly, that also means you're not breathing right. That has a huge impact on your whole, from head to toe, because if the tongue isn't doing what it's supposed to do, it's utilizing your traps and is utilizing all these muscles to swallow. So you see it in babies when they're on the mom's breast and they're tongue tied, they're sucking away. The mom's like, I have no issues, but this is the baby on the breast doing this. So we don't do this as adults because our muscles are so tense, but we're doing micro movements of all this moving forward in our jaw, because we're getting our jaw to do all the work for the tongue, but it should be the tongue that should be working in isolation, right? I know I digress. I'm sorry. It's too hard.
I think this is a really cool opportunity too for hygienists working in a dental office, hygienists working independently, a great thing to market and give the right information to your patients. So I think this is a phenomenal goal for everybody to learn a little bit more about and to offer the right information to your patients. So if somebody wants to reach out to you, attend some more courses, I know Cass got some set up, and she's going to go over some of the highlighted courses that we have coming up in the next month. And of course, you are one of our star people that we have at RDHU. But as far as information or resources for them to get some of this stuff, can they reach out to you? Do you have a website that they can kind of connect with you to get some stuff to go forward?
Right. The easiest, yes, I have, they can email me, but Instagram's been pretty good. So a lot of you guys have been reaching out to me for like quick questions, or collaborating out with patients. So you can reach me at just at Dr. Mandeep Johal. That's my handle. My email is drmandeepjohal@gmail.com. But yeah, I would love to help you guys. So because I do get a lot of questions like, what do I do? Where do I start now? This person's definitely tongue-tied. What do I do? Who do I send them to? Or what do I do? I don't really do myofunctional therapy. I don't do myofunctional therapy in my clinic. Like I said, I only do with my ortho patients. Everything else I refer out to you guys. Anybody that comes to me that needs help with their tongue or breathing, I refer them out to you, the myofunctional therapist. But then I will do the release if they need it. Not everybody needs a release. Or I've been getting a lot of referrals for like, Mandeep, this tongue has nowhere to go. Can you expand them? Can you do some orthodontic treatment? So then we work together with that. Right. I did want to share one last thing with you, because a lot of people want to know studies, and, oh, is there any research that supports this? There was one really cool study. I don't know if you guys heard about this. It was done on monkeys, on chimpanzees, where what they surgically did was they surgically plugged these monkeys' noses with silicone plugs. And they washed them over time, because these monkeys were habitual nasal breathers, and then they became habitual mouth breathers. And over time, they literally saw their faces changing. They got crowded teeth, they got narrow palates. Like, it was insane to see that in the lifespan that quickly, but how quickly nasal breathing or mouth breathing can affect the development of the face. So I thought it was really cool. I'm like, oh, we can't do that on us, but
no,
to prove a point, right? Like, so people ask for scientific stuff. I'm like, how are we going to do an experiment on your child? Do you want to maybe take one child and not the other and see what happens? Like, yes, read the book Breathe by James. James Nestor is amazing.
Doris.
He talks about it. He actually did an experiment on himself and his colleague, to see the effect of what they did was they taped their noses, or they somehow closed this, and they did tests, like they checked their O2 stats, they checked their heart rate variability. They did all these amazing tests to see the effects of mouth breathing physiologically, which is kind of cool. So it's all in his book.
Good. I know Kathleen's going to share some information about courses coming up. There's just 2 questions, if I could just pose those to you before we give them more information. One was, could you just in summary, just talk about the benefits of nasal breathing over mouth breathing? If you were to put together like a few lines, could you summarize that for us?
Okay. There are no benefits of mouth breathing at all, like at any time, even when you're working out. So nasal breathing benefits, the reason we want to nasal breathe, the most key reason is going to be nitric oxide. So nitric oxide is only produced when we breathe through the nose. So by breathing through the nose, you're releasing nitric oxide, and then that helps dilate blood vessels. And if it's dilating blood vessels, you're also getting more oxygen. They've done actual studies that show increasing nitric oxide has actually increased oxygenation of tissue, especially the brain, by 20%. So nasal breathing alone, that's how we wake up feeling awesome. When some people start taping for the first time, they're like, I felt amazing. It was the best sleep I ever had. Is usually related because of nitric oxide, because you're getting that proper oxidation of the brain and because of nitric oxide. So that's what I would say. I mean, there's so many more, but that's where I would say.
No, that's a great summary. That's very, very good. Just one more question about, I think it was the kinesiology tape that you were talking about. Do you buy that from like your local physiotherapist, or where are you getting those from?
Amazon.
Amazon, okay.
I'm a girl of convenience. We don't have enough time. Like, I feel bad. I mean, just do your research and see. Like I told you guys, I use the one for sensitive skin for myself. My kids were okay using different ones. I get bright colors for them. And we use the one where we open, and I showed you guys how to do it. I use that for them.
Beautiful.
Awesome.
All right.
What amazing learning today.
Oh,
Wow.
yeah.
Yeah.
Not enough, guys. I'm telling you, an hour is not enough. That's why you got to watch my course so we can go even
Yes.
more in depth.
I'm going to just share my screen here.
Before you do that, Dr. Johal, there was a question about vitamin D levels as far as where can you get it tested? Do you want to, or can you address that?
Yeah, your naturopath can do that for you. It's much easier to go through a naturopath than your family doctor, but family doctor can do it too. But remember, guys, in this country, it costs us money. They won't do it for free. But your family doctor probably will say there's nothing wrong with you. You don't need to get it tested. But yeah, your naturopath would be a good guess. And yeah.
Good.
Thank you.
Go ahead.
Yes.
It's awesome. Hopefully I'm going to do this correctly here.
Yep.
Can you see?
We can see you can see presenter notes. There you go. You're good now.
All right. So what's coming up at RDHU? So we have the lovely Dr. Mandeep Johal, and she is presenting the dental hygienist's role in connecting the dots between tongue ties, myofunctional therapy, and orthodontics. And I think this is the one where you have Joe Siegfried as your guest, right? Special guest. And you share.
Yeah, I gotta remind him he has to join me at that time.
Yeah, because he's in here in the course description. So that'll be great. So that's starting, it's 5 hours, and it starts on Thursday, November 17th. I think it's at 7 p.m. And then we have Joe's course. It's a 30-hour myofunctional therapy. It's a training program. So there is a prerequisite course that's 6 hours, and that's the intro. So it's like mysteries of myofunctional therapy. So if you have taken that, then you can go on to the 30-hour program. And if you haven't, we would send this one to you right away. And that starts on October the 11th. And then it's every week for on Tuesday nights. And then the hands-on is on November 26th and 27th at RDHU. We then have ortho. It's an ortho 101 for dental hygienists, and that's a practical hands-on program. The theory is online. It starts October 13th, and then the hands-on is, I can't see my screen here, October 29th. Then we have some virtual coaching with myself, sharpen your skills. We look at our instrumentation, our hand instruments, our ultrasonic inserts, and we look at the wear and then how to maintain. And then we have the next virtual coaching is with Danny Botbill, which is a fantastic course. You'll learn so much about ultrasonic hands-on, but it's virtually. So Danny does a great job at really getting in there with the hands-on experience. And then these are all of our live streaming courses: independent practice coming in January, cannabis awareness, and then Dr. Johal, easy steps to the AAP classifications with Carrie, essentials for documentation with Anna Louise, HIV, take the stigma out of the dental practice with Joe, that's a new course coming, and then influencing biofilm balancing with oral probiotics. And we've just started carrying the oral probiotics Bliss with through RDHU. So that's exciting. That's all available to our dental professionals at a wholesale price. And then this is more the mysteries of myofunctional therapy. If you're interested in diving a little bit more in without taking the full program, national best practice with Anna Louise, implementing the classifications with Anna Louise. If you just wanted to take the theory for ortho, that's available. Prudent jurisprudence with Beth Ryerson, Christine Crawford, radiography refresh, and that was a really popular one. That it was just a really well accepted one as well. Recipe for charting success, the ADPI approach, red flags, what you should never ignore, and then your global power, a call to action. What is your role? And that is everything that's coming up over the next couple of months. And then I know, Beth, we have a lot more coming, and I think you've already planned next year's calendar, right? It's all good to go.
I have lots of exciting things for sure.
Lots.
Yes, it's the calendar is a masterpiece of just very exciting courses to come. So yeah, we're pretty excited.
The puzzle.
It's a puzzle, yeah, it is.
This was an amazing show. I know we've learned so much, kind of been inspired to creep on our children and our partners and all the rest that way, kind of see how things are and how people are sleeping and sitting up straight as our posture and breathing through our nose. But inspiring and lots of information today, whatever time you're watching it. I don't know what time zone I'm on today, and I'm in Ontario, so I should know what time zone I'm on, but we really appreciate you taking the time out of your very busy schedule. And for all parents that are joining us today, or caregivers of some sort that have children at home, Dr. Johal has hers at home as well. So they've been very good for this hour to give for that hour on The View with us today. So thank you for fitting us into your busy schedule today.
And I will send a follow-up email with some extra things that you can just simply click on the links and it'll give you more information. So stay tuned for that. You'll have it by Tuesday because Monday is the holiday, and wishing everyone a happy Thanksgiving to our Canadian members, and enjoy this. Hopefully it's a lovely weathered weekend. It's hopefully sunny, but who knows what's going to happen up here. It's not calling for the best weather up north, but.
And again, for anyone that joined us late, happy National Dental Hygiene Month. We want to celebrate that as well. And we are taking a break for November with The View. We won't have a show there. We had a few different conflicts. We're speaking at different venues and stuff that we couldn't kind of coordinate our schedule. So we're taking November off, but we will be back in December. So our next show will be December. I wrote it down. Where did I write it? Anyways, it's in December. Look on our website. We'll have
Friday. It's always the first Friday of every month.
Friday of the month. Exactly. So we will be back and excited to share that show with you.
The after experience.
Thank you so much for having me, ladies. Have a great weekend.
Thank you. Thanks for being here.
Everybody loved the session, Mandeep. We're getting lots of good.
I'm so glad. I love doing this. Thank you for letting me be part of RDHU. I love my mug too.
Being a part. Thank you. Okay, ready? Let's hold because I want to take a little.
Yeah.
Let's
sure.
all do.
Oh, okay.
Then I'll take a sip capture. Anna Louise, where's yours? Oh, it's packed in with your kitchen.
Packed in my
renovations.
Yeah.
Well, that was great.
All
I
right.
spend some time with all of you. It's always great.
This is
It
so
is.
fun. I love this.
Well, we'll
We gotta
definitely
When you
have
have to come
do
back.
more live
Yeah,
stuff
have
with you
to come back.
guys. I miss like the live. Like I love the energy when people are around. So
I know.
fingers crossed.
We'll talk. You and I will talk.
Yes.
We'll make it happen.
We'll do a live one for sure.
So
Okay.
many
all right.
ideas. Bye guys. Happy Thanksgiving.
Happy
Happy
Thanksgiving,
Thanksgiving.
everyone.
Happy Thanksgiving.
Thank you.
Bye.
Bye.